Hello and welcome to Newsmakers on CHCH Podcast. I'm your host, Louie Butko, and today I'm very pleased to be joined by the Hamilton Spectator health reporter, Joanna Frketich. Joanna has spent over 20 years with experience on the beat covering hospitals, medical research, public health issues, long-term care, and much more. Her series last week in The Spectator was entitled Overtime, taking a look at how staffing crises at Hamilton hospitals and among advanced care paramedics is leading to increasing reliance on overtime to staff the city's healthcare system, including pushing nurses' salaries over $200,000 a year and leading one paramedic to be in the top 10 of Hamilton city salaries on the 2022 Sunshine List. And Joanna, this is a really interesting series because I think we get the sense that healthcare workers are burned out. This really puts a number on it almost, doesn't it?
Well, absolutely. I mean, this shows how really Ontario-wide, this is a Hamilton look at how Ontario-wide overtime is being used to staff the healthcare system, which is a bit of a vicious cycle because you have, you're short-staffed, so you need staff to work overtime to fill in those gaps, but then you burn out that staff and then they flee to jobs with better hours and you end up with bigger staffing shortages.
Yeah, the one quote here, this was in part one, to get into this series about nurses. You write here, the Band-Aid solution to the increasing staff shortage takes a toll on hospitals, nurses, and patients. The surging overtime creates a vicious cycle. Not enough staff leads to nurses working more hours until they are so burned out they flee to jobs with more reasonable workloads or leave the profession altogether, making it even harder to cover shifts. Stuck in the middle are patients who face longer wait times, postponed care, and questions about safety. And really, that's kind of the crux of it, is it not? Is that these are nurses that get burnt out. These are paramedics that are making a lot of money, burnt out, but it's the patients who are feeling the pinch.
Well, absolutely. Because as the staffing shortage increases, you have more postponed care or you are waiting longer in the emergency department or there are fewer ambulances on the road to respond to calls because, they're stuck in the emergency departments. There's also a study that came out from CHCH, the Canadian Institute for Health Information, that showed that different types of preventable injuries go up the more burned out that staff are and the more overtime that staff do. And that was something also that the Canadian Union of Public Employees, CUPE, raised that point as well, as they have concerns that with the more overtime you do and the more exhausted you are, it's only human that mistakes will be made. So, the feeling is that the worry is for the staff, but also for patient care.
Well, it's just common sense at that point, because you think of somebody who might be working their 18th hour of a 24-hour shift that are covering 6 patients bouncing from room to room. I mean, things are going to fall through the crack, and it could be your parent, it could be you, it could be your child. That's the scary thing about this series, I think.
Well, and also, the Ontario Nurses Association, which is the union that represents nurses, they talked a lot about the moral distress, the moral injury that nurses and other healthcare workers feel, that it's very difficult to, you're doing a job that you're really passionate about, that you really care about, that you care about patients. And really a lot of them, they voluntarily take that shift because they want to make sure the patients are taken care of. But then at the end of their shift, she talked about a lot of them crying at the end of their shift because they felt like they just couldn't give the care that they feel that they should be giving to patients. And so that causes, a lot of moral distress to healthcare workers when they feel they can't give the care that they're trained to give.
Yeah. I mean, I've been to rallies. I've talked to nurses. My mom was a nurse for a while. She got burnt out really early on in her career, 45, 50. They opened the new hospital in St. Catharines and it was just too much for her even then.
Yeah.
I want to go back to the start, though. What sparked the idea of this feature, this series? Was there a certain number? Was there a certain series of numbers? That's usually how we work as journalists. Yeah. We get something that catches our attention. What was it about this story that caught your attention?
Well, I actually am the reporter at The Spectator that does public salary disclosure every year. So that is the Sunshine List.
Sunshine List.
The Sunshine List for everyone making $100,000 or more from the public sector. The government puts out that list once a year. So I have done that list, for, decades now. now, really, for the Spectator. And so when you have that kind of experience working with that, you notice differences in the numbers. And so when I was doing the Sunshine List for 2021 salaries, 2022 salaries, I could see just by looking at the numbers that there was a huge difference from 2019, from before the pandemic. And so I thought I really need to take a closer look at this, because that's just for me eyeballing it, knowing that, these are numbers I have not seen
We're talking about, so I have some of the numbers here. You have, so it's not just a few workers putting in substantial amounts of overtime. The number of Hamilton hospital nurses earning $140,000 or more. And again, this isn't a conversation about nurses making too much money. Nobody is saying that. Let's be clear. Neither you nor I or anyone reading this series should have their takeaway, man, these nurses and paramedics are making too much money. That's not what we're trying to say. Because there are staffing guides. Registered nurses make a top salary of $90,000 to $93,000 under a central agreement with Ontario's hospitals. But as you write, Public Salary Disclosures reveals Hamilton's highest paid registered nurse made $238,000. And that it's not just a few workers, as you said, 76 in 22 made over 140,000 from 6 in 2019. I mean, those are pretty staggering numbers for somebody who studies these numbers a lot. Well,
especially because in 2019, the top paid registered nurse in Hamilton made $148,000. So you're now talking, you have, 76 nurses. That was a sort of an unusual case back in 2019, but now you're seeing more and more nurses making those types of numbers. And the other thing that was unique about this time is that you really could isolate it to overtime, because right now there's wage suppression legislation in place, and that caps raises to nurses at 1%. So it's not like there was a union settlement that, there was a lot of raises, and so you see a big jump in the salaries. This was really something that could be the unions and the hospitals themselves attributed the majority of this to overtime.
Speaking of hospitals, you didn't get much of a response.
No, I didn't.
From Hamilton Health Sciences or St. Joe's. You've covered the health beat. I'm sure you weren't surprised at the reluctance to talk, but didn't you feel like that maybe this is something that they would want to be in front of and not just have a statement put out?
Well, I was a bit surprised, because I feel this is a very important issue. Public health was the same, and their staff worked, very significant hours during the pandemic. The hospitals as well. So, this is an issue that is a long-standing issue that has really big repercussions for the healthcare system. Unfortunately, I feel statements are something that have become quite usual now. Yeah. It's very rare, actually, to get interviews these days, which I think is really unfortunate, because I think that there is a real missed opportunity to really tell the public, about an issue that is not the hospital's fault. It's not like Hamilton Health Sciences or St. Joseph's are the only hospitals in Ontario struggling with this. Every hospital in Ontario is struggling with this. And it's not just nurses. You could probably pick any health profession and find these same types of numbers. And I feel this was a really big missed opportunity for them to talk about what they're struggling with.
You mentioned, first responders here. Hamilton paramedic earned, this is part two, talking about paramedics. A Hamilton paramedic earned more than $250,000 last year. Again, not saying that they didn't deserve it. This was hours they worked in overtime. But one paramedic cracked the top 10 salaries for city staff. That was $251,000, while another made $222,000. And Deputy Chief of Hamilton Paramedic Services, Russ Crocker, says it's overtime.
Absolutely. And a big problem for paramedics is getting stuck in the hospital emergency room. So a lot of this is related, that you need more paramedics to work overtime when there is a lot of them stuck waiting to offload their patients in the emergency department. They're supposed to offload within 30 minutes, and a lot of times it takes hours for them to offload. So that leaves fewer ambulances on the road. It means that more paramedics are, needed maybe to work the overtime, so that there are ambulances on the road. The other thing was with paramedics was there was a sharp increase in mental health related time off work. So I think that also speaks to the burnout that's there, or to what paramedics are experiencing for a number of different reasons. There's a lot of socioeconomic things that they deal with. So, I think it speaks to a lot of issues sort of colliding at once.
Well, we saw Niagara EMS workers just recently be very disappointed with the amount of mental health funding that they got in their new deal compared to what police get in terms of mental health. I have a feeling it's a similar story. Is that, again, there's burnout, and then there's jobs where you can get burnout, right?
Yes.
Us as a journalist, yes, we can be tired. We could be telling the whole story, but these are the jobs that you absolutely want whoever is working to be at the top of their game because they're dealing with your health.
Well, and they're frontline, especially paramedics. They're out on the streets on the front line, and they deal with some very difficult issues. Yeah. And clearly, there is some need there when you're seeing that type of rise. That also, I should be fair to say that rise also corresponded with a change that. First responders who are off work are now assumed, if they have PTSD, it's now assumed to be from the job. Wow. So that was a bit of a change that helped with this rise. But you really saw a pretty significant increase that I think speaks to the fact that, this is a discussion that we should be having and something that maybe we need to be acting on. So
a lot of these numbers, we look at 2019 and we look at 2022. There was a very significant thing that happened in 2020.
Yes, there was.
How is this? Did this just hit fast forward times 100? Was this something that you had seen was starting to be a problem? And when we talked about Bill 124, is that played into it? I mean, what do you make of the last 3 years and these numbers that you've delved into?
Well, there's no question. The pandemic has really contributed to a very significant staffing crisis. The problem was that hospitals, paramedics, a lot of these healthcare worker, long-term care homes, a lot of these places were understaffed before the pandemic. But the pandemic was very difficult on healthcare workers, and a lot of them left the profession in droves. So they retired. Maybe they chose this moment to retire, or they chose this moment to leave frontline care and do a different type of work in healthcare, or they decided to become a different profession. And so that has really exacerbated what was already, when you already had a staffing shortage, and now you have a significant number of people leaving during the pandemic, that really, that really made things a lot worse and made this situation, the crisis that it has become today, that you're seeing in a lot of different that you're seeing in so many different ways. Across
healthcare workers, nursing, personal support workers, and healthcare workers, according to Statistics Canada, in 2022, there were 95,000 vacant nursing, personal support workers, and healthcare worker jobs. And the number of nurses that were self-employed or working for a private nursing agency, which we haven't gotten into yet, that went up 6%. So your math here, which I trust, 867 fewer nurses in public health care. That's just that 6% of people who are leaving. So if they're leaving, if you're having trouble recruiting, how do we solve this problem? It's a very difficult problem. And the hospitals here really struggled with it. As of July, Hamilton, just St. Joseph's and Hamilton Health Sciences alone were short 2,700 staff. So that's 2,700 vacancies, like jobs they can't fill. About 1,000 of those are nurses. And, they have tried a lot of different ways to find ways to recruit and retain staff. But the problem is everybody is in the same position. Every province, every city in Ontario. So it's pretty stiff competition, and really there isn't a lot that's been done to address the workload problems. I mean, the unions have really said that the solution to this problem is really dealing with these workload issues, that it's very hard to recruit and retain when people are looking at this type of job atmosphere that they have to go to. There has been a lot of call for minimum staff to patient ratios. Some have said that might help. Which you would think should be something that people would push. I mean, absolutely. Minimum staff, like the fact that there's not one currently. Yes. That's concerning. You've been on the beat 20 years. Does it not shock you that we can't even get that done? Well, and I think that's very difficult on staff, because when there aren't those minimums there, you could be a staff member who is, when it's not because anybody is doing it on purpose. It's just that there's, that shift is so short and they weren't able to find anybody, that, you are looking after a number of patients that you feel you can't do the job that you should do. I mean, Hamilton Health Sciences and St. Joe's both tried for a while to have double time. They paid double time for people to take on shifts on their days off. Wow. There was like a team of people who agreed to do that. But in the end, they had to stop doing that because they just felt it wasn't
sustainable for people to be working these numbers of hours. But I'm not really sure. It's a very difficult problem that I think is going to take, I don't think there is one thing that could fix this problem. I think this is something that is going to take a number of different things to try and fix it.
So I think the last healthcare rally I covered was at St. Joe's. And it was, fighting against the privatization of healthcare. And that's a big, with these nursing associations, we're seeing a lot of this. And they're in a tough spot, too, because they want to support their members as best they can. Absolutely. And if that means doing what's best for you mentally and physically, they're not going to try to prevent you. How much is privatized healthcare, or what nurses and healthcare associations are calling privatized healthcare, because I know the government would push back on that framing of the question. But how much has the Doug Ford government played into what we're seeing here?
Well, a lot of these issues have been a long time coming. I've been writing about a lot of these issues. I've been a health reporter for more than 25 years. And sadly, some of these issues I've been writing about for 25 years, they just seem to really get a lot worse since the pandemic. So you're really sort of seeing decades worth of issues that have not been solved suddenly kind of coming to a head right now. I do think there are some issues with privatization that we're really seeing right now. One is the use of agency nurses. That has been found to have skyrocketed. So these are almost like temporary agencies that send in nurses to hospitals when the hospitals can't cover the shifts. They've long been used. They've been used for decades now, but their use has really gone up. For a while, Hamilton Health Sciences actually had an agreement with the union not to use these agencies, but they had to go back to using them recently because they just can't staff any other way. I know the unions have always argued that these agencies take away staff from the public system. I mean, I think that's always been one of the big worries, is that the private care takes away, there's only one group of staff. So the worry is that it takes away care from the public system. The government has always said that there are safeguards in place for that not to happen, but it's hard to say. I think the other thing you have to watch with private care that we're seeing in long-term care, I just recently wrote a story about a Dundas long-term care home that was supposed to be being rebuilt, almost 200 beds being rebuilt in Hamilton. We desperately need those beds, but that home has decided to close instead. The private owner has decided to close that home instead of doing the rebuild. Partly because of the costs of modernizing. Instead, they're building residential housing. Wow. And I think there's a lot of worry that a lot of other long-term care homes will go the same way. So I think when it comes to privatization, there's a number of different issues that, there's the staffing issue. There's, the fact that these are companies that need to make profit. So if, the way the healthcare model doesn't work for them, then of course they're not going to stick with it. They're going to get out of it and do something else or do it in a different way.
And I think, I that wasn't a question to blame the government for any of the issues we're having, but I mean, there are some things that, that are working. And you had a story just a couple of weeks, we saw a report from the Hamilton Spectator, from McMaster that you wrote, of course, in the Spectator, that said telehealth, when done right, when done with the right issues, it can work, right? There are solutions there that maybe people push back against, but there are solutions here that are working, are there not?
Oh, absolutely. That was a great study. That was from a study by McMaster University. They wanted to look at, because virtual care really, obviously during the pandemic, for obvious reasons, virtual care really surged by a lot. And that was something that really hadn't existed very much before the pandemic. So this is, when I say virtual care, I mean people having appointments by phone, by video. So since the pandemic, the government's been kind of trying to rein that in, been trying to curb the virtual care and get everything back to in-person visits.
From McMaster.
But so this study found that actually virtual care does have its place. It found that I think it was a bit of a surprising result that doctors and patients seemed to be using virtual care appropriately, which means that they were using it for the people who really could be seen virtually, and that the people who needed to be seen in person were being seen in person, and that they found that this care was quite safe and effective when it was used appropriately. And that might be a good thing that we need to look at to help solve, obviously solve everything, but to help, provide some relief in some of these areas.
Even pharmacies being able to diagnose little things. I mean, you've obviously reported on the follow through that. That was a Ford government announcement. Is that working?
Well, one thing you see that working is with vaccines, because COVID vaccines, obviously at the beginning, were given primarily out by public health clinics. So, we had the First Ontario, they transformed First Ontario, they had the roving mobile clinics. So mostly it was public health delivering vaccines. That has now drastically shifted, that pharmacies give out the majority of COVID vaccines now. It's easy for people. Most places don't even require an appointment. You can go and get your COVID shot and your flu shot at the same time at a pharmacy. So I think that shows that has been a place where adding pharmacy has really made a big difference.
Looking back, I mean, we talked about before we hit record here that it's obviously more difficult than ever to be in the first responder field. It's hard to be in our field, that being journalism. I have to imagine, like, for you, combining those two things, two very precarious industries, the pandemic, the various responses you got, I'm sure, to your pandemic reporting. I know it's a job, but why are you still doing this?
What
do you get out of this job?
I love health reporting.
Yeah.
I became a health reporter actually by accident. People always think it was, a passion of mine coming out of school, or that I have a health background. I actually don't. Health wasn't even on my radar when I was first out of school. And how I became a health reporter was that I was offered a job at the St. Catharines Standard, and and the job happened to be a health reporter. Yeah. And so when you're young, you have to take the job you're offered. It was a good job, so I took it. And I discovered, to my surprise, I think I expected to be on the beat a short time. I'm not sure I expected to really love that beat. And I discovered, to my surprise, that I love health reporting. Because health reporting, first of all, it's something everybody cares about. Healthcare is something that touches everybody's life. There's always going to be a moment where you need a doctor, or you need the healthcare system, or you're dealing with something yourself. So it's something people really care about. But it also is just such a varied beat. I get to cover, I've gone to very cool research labs and got to write about really exciting research. You get to be a bit of a watchdog for the hospitals and the government on their policies. You're talking about, the hospitals, they have billions of dollars of public money. And so it's really important that somebody, is kind of keeping an eye on that. And sometimes they do really incredible things with it. So it's also good to be there to report on that. But you're also a voice for patients. That's also a very vulnerable group many times, that they really need your help when they're looking for it. And it's really something to be able to be a voice for them. You also are able to connect patients to one another. A lot of times patients feel very alone. They don't realize that there's actually a whole group of patients going through the same thing as them. And by writing one story, you can make such a difference. I can't tell you how many times I have received an email from someone who's saying, I had no idea that other people were going through the same thing as me. Like, this has just made such a difference for me. So, I think with the Health Beat, there's just so many things. And then, of course, during COVID, I was writing breaking news for 2.5 years, like breaking news every day.
Yeah. Do you remember, as the health reporter, like, can you remember, do you remember that first article you wrote on COVID?
Oh, absolutely. Because, the first article I wrote on COVID,
January 2019.
It was actually to say that public health thought there was a low chance it would come here. So that turned out to not be correct. But when COVID first hit, I think all of us expected it to last maybe, a few weeks or a month or something. So we had no idea that it would be such a sustained story. And even today, we're still seeing the effects of COVID today. And I think a lot of people feel the pandemic is over, but it's not.
Let's get in that. I mean, A, it's not over, and B, as a health reporter, seeing what happened and the talks of a more advanced variant or it redeveloping again. I mean, how much of COVID is, how much of your life is still COVID related?
Well, I think as a health reporter, all health reporters really, we've had to come up with a new balance, because you have to find a way to get back to covering the beat, because there's a lot of important health stories and they got dropped for a bit there when my entire focus was COVID. So you're really trying to get back to those very important stories. But at the same time, you really have to keep your eye on COVID and RSV, actually. RSV, flu, like the respiratory season has become a lot more severe. I mean, last year, the respiratory season caused an absolute crisis in pediatric care, which it's very rare you see a crisis in pediatric care. I've written a lot about, the hospitals, the adult hospitals get overcrowded every respiratory season, but in all my years on the beat, I think last year was the first year I ever wrote about children's hospitals being utterly overwhelmed. And so I think that's something that, I really have to always keep an eye on what's going on with COVID, try and also keep people engaged so they do go out and get their vaccines when there's time, because, I think COVID will be a lot like flu, that you have to go once a year and get your shot. And, and so it's to try and help people sort of wade through the disinformation. I think that's the other big thing that has come out of the pandemic was before the pandemic, there wasn't the same level of disinformation and misunderstanding that there is now. And so I think a health reporter's job it's become very important to help people wade through the misinformation, to find what is the good information, the most relevant information, because you need that information to make important, informed decisions about your own health care.
So all the keyboard doctors and nurses out there, I mean, you must, especially as a health reporter, I mean, I get the fake news, I get the, government bot media, but as a health reporter, I mean, how long did it take you to turn off your notifications or mentions? Or because it's just it must have been awful. Like, genuinely, there must have been some awful things said. Oh,
absolutely. Well, I think to be fair, it's not just health reporters. I think every reporter is feeling that. It's very different from before the pandemic. I always say before the pandemic, people would reach out to me and they would talk to me about my stories. It's inevitable that some people, they're going to have some things they don't like about my stories or have some strong feelings. And that was always very productive. I found often you could have really good discussions with people who reached out to you. And, the discussions would be about the story. I think what has become very different since the pandemic is that these have become very personal attacks against reporters and sometimes threats against reporters. I've had someone email me to say they know where I live, they know where my kids go to school. I think that's something reporters didn't deal with a lot before the pandemic, and now it's become much more personal attacks. You aren't able to have those discussions with people. So I still keep an eye on my notifications, because there are still those groups that just are talking about my story, and it can be really great to have a good discussion with them about the story. But for the most part, yes, you do have to kind of find a way to block out that negativity and those very personal attacks.
Speaking of negativity, let's go to the opposite side. Let's think of some positivity here. I tend to throw this question in most of the interviews I do. Give me a reason to be optimistic about walking out of this room right now.
A reason to be optimistic about healthcare in particular. About
healthcare in particular, however you feel. It's the holiday season if you want to go that route too, but just give me a reason so when we turn off the mics, I can go out of the door with a smile, other than the great chat we've had today.
Well, I think, one thing is, like I said before, I've been writing about a lot of these issues for a lot of years, and I don't really feel they've had the attention maybe that they should have had. You get kind of frustrated. You write year after year. I'm like, how many times do I have to write about people being stuck in hospitals because they can't get into home care or long-term care, or staffing shortages, or, the trouble ambulances are having, offloading patients in emergency rooms, and the distress that healthcare staff go through. So I've been writing about a lot of these issues for a lot of years without feeling like sometimes people have really engaged with it, where since the pandemic, I think the pandemic really put a spotlight on a lot of these issues, and I feel like there's some movement on them, or at least some attention to them, and the public is much more engaged in them. So I feel very optimistic that you might start to see, it's a long time to turn some of these ships around, but you might start to see, some movement on some of these issues that's long overdue, because people have really seen these issues and seen how these issues affect themselves, affect patients, affect workers. And so I'm hoping that the spotlight that's been badly needed is finally sort of there.
They might have seen it, or in this case, I mean, they could be watching it because there's a camera right there. But in this case, they could have listened to the issues here on the podcast. Joanna Frketich, thank you so much for doing this. I really appreciate it. Great insights.
Great. Thanks so much for having me.
My thanks to Joanna for joining me today. And my thanks to you as well, because you know what? We could not do the show without your support. So however you found us here on CHCH Podcasts, make sure you like and subscribe so you never miss an episode. If you do happen to be watching us, there's a QR code you can scan right there on your screen. If you're listening to us, you can go to chch.com/podcasts. My thanks to Mike Corson for directing today's episode. One more time, thank you for listening and or watching. From all of us here at CHCH, I'm Louie Butko. Have a great day.